Hi everyone, I'm Ashley from Premier Athletic Therapy.
And I'm Nick from Concussion Talk.
And today we're just going to talk about our shared interest in concussion injuries, so whether that's from sport or acquired head injuries, and just how there are different platforms, I guess, to test for concussions, different tools. So we're going to talk about the Scat 5 today, which is a sport concussion assessment tool, edition number 5, and also a tool called HeadCheck Health. So this is it a Canadian company?
It's in Vancouver.
Okay, a Canadian company that specializes in an online platform to administer the Scat 5 in addition to some other tests.
They help organizations make sure everyone in the organization can see it and make an informed about the organization.
Right.
So that they know, organization or team will know what player is doing, how they're doing assessment wise, and how they did in their original assessment. So
Right. So we're going to just show a quick review of the Scat 5 documents and then the HeadCheck document. So Nick's got a copy of the Scat 5 document here on PDF file. So normally at the clinic we'll use it as a paper copy, but it gives all your instructions on how to administer the test. You do want the test administered by a healthcare professional or someone who's comfortable with it. So the red flags for concussion they include neck pain or tenderness, double vision, weakness or tingling or burning in the arms or the legs, severe or increasing headache, a seizure or convulsion, a loss of consciousness, deteriorating conscious state, any vomiting, and increasingly restless, agitated, or combative. So these are your red flags if someone sustained a head injury, and again, we know that you don't have to get hit in the head to sustain a concussion, but if anyone does have these red flags, you're advising them to go seek further medical attention. So you're sending them to the emergency room. So hopefully that's not the case. So the nice thing about the HeadCheck Health is that it's based off of the Scat 5. So if we just have a quick look at the computer, we can see that those red flags are just here. We're asking Matt, our patient for today, if he has any of these symptoms. Hopefully he says no. So we want to make sure that Matt's neck feels okay. We obviously don't want any pain in his neck. That's not quite how we would do it, feeling good. So then we get into symptoms. So this is what myself and Matt see a lot of at the clinic, either through baseline testing, or post-concussion. So it's based on a scale from 0 to 6. So 0 is no symptom, 1 or 2 is mild, 3 or 4 is moderate, and 5 or 6 are severe. So if Matt was here for a concussion evaluation, I would ask him if he had a headache and then to rate it on that scale from 0 to 6.
0.
Perfect. Any difficulty concentrating?
Yes.
What number would you give it?
I'd give it a 4.
A 4, wow, okay. Difficulty remembering?
2.
Yeah, those projectors. Fatigue or low energy?
3.
Confusion?
2.
So when we use the paper version of the Scat 5, we've got to add up all of those symptoms. Not that that's challenging, but for HeadCheck, it just does the work for us. So the total number of symptoms that Matt reported was 9, and the symptom severity score, based on the number that he gave me on that scale from 0 to 6, is automatically calculated as well. So then I would ask Matt if his symptoms get worse with physical activity.
Yes, they do.
And do they get worse with mental activity?
Absolutely.
So mental activity meaning things like reading, looking at a computer screen, watching TV, looking at your phone, things like that. And then I would ask Matt, if 100% is feeling perfectly normal, what percent of normal do you feel?
We'll say 70.
70. So then we get into more challenging assessments. This is cognitive assessment, so how his mind is working. And then we would ask a series of questions there and mark them correct or incorrect based on Matt's response.